Chapter 4, communication and role of the technician with a customer and patient. We'll skip over the terms and definitions because we'll cover them throughout the chapter. Probably one of the most prevalent concerns of pharmacy managers and pharmacists is the need for pharmacy technicians who are competent in the area of communication. Communication is the ability to express oneself in such a way that one is understood readily and clearly. Pharmacy technicians communicate daily with coworkers, healthcare professionals, and customers. Effective communication skills are critical in achieving optimal patient satisfaction and trust. Virtually all employers consider basic communication abilities a prerequisite to hiring. A competent technician has excellent written and verbal communication skills. In addition, technicians are expected to use skills such as diplomacy, compassion, sensitivity, responsibility, tact, and patience. Good communication is also important for patient safety. A technician who knows exactly what the patient needs and understands how to communicate is able to assist the person with competency and accuracy. The communication cycle involves two or more individuals exchanging information. The cycle consists of a sender, a receiver, a message, various channels of communication, and feedback. The sender is the person who initiates the communication and sends the message across a channel. A channel can be written messages, spoken words, or body language. The receiver decodes the message and provides feedback according to his or her understanding of what is being communicated. To provide optimal patient care, pharmacy technicians must have a clear understanding of the communication cycle. Active listening is a communication technique in which listeners confirm understanding by restating or summarizing what they have heard in their own words. This helps both parties make sure the same thing is being discussed. Active listening helps keep the focus on the patient. Always remember the perception of the communicators when trying to convey a message. Showing empathy and listening are key components of assuring the person that you are listening and are concerned about what they are saying. Sometimes just listening to a person is all that is required. If a customer is angry about a medication, regardless of the problem, just listening can ease the person's frustration. Instead of talking over the person or telling the person that he or she is wrong, try to listen until the person is finished and emphasize with the dilemma. Most customers know a problem with a medication is not the fault of the pharmacy technician, but they want to be heard. A professional does not allow himself or herself to be directed by another person's inappropriate behavior. We must always remember to behave professionally. Nonverbal communication or body language is the act of giving or exchanging information without using spoken words. Everyone communicates on a daily basis. However, rarely do we take a step back and evaluate how effectively we are communicating. One important aspect of communication is facial expressions. The old phrase, actions speak louder than words, is true. When technicians are working closely with customers in the pharmacy setting or with coworkers, it is important that they maintain a caring but professional attitude at all times. Box 4.1 lists examples of negative body language. So Mrs. Lehman walks up to the counter to have her prescription filled and asks whether it can be done within 5 minutes because her bus will be leaving. John, the pharmacy technician, rolls his eyes and shakes his head in disbelief, wondering why patients think they should never have to wait. He turns and walks away without saying a word. An alternate response, John shows concern for Miss Lehman and tells her that her prescription will be filled as soon as possible. John can ask the pharmacist to please fill the prescription as quickly as possible. And then procedure 4.1 is just a procedure that you can practice with maybe someone in your house on nonverbal communication. So, verbal communication is the sharing of information by individuals through the use of speech. It is an important tool in the pharmacy. It is a skill that must be learned and practiced. To be an effective communicator, you must remember that your words and your voice are not always in agreement. Each is a separate entity and can be used to work for or against you. Remember, verbal communication skills have two parts, vocal and verbal. Your voice is a powerful tool that affects the customer or person to whom you are talking. Words alone do not necessarily convey your meaning or feelings. The inflection, which is the pitch, tone, speed, and volume, add multitudes of information that is being picked up by the listener. As an example of the use of inflection in the following statement, stress the cap word while you say each statement to a partner. So if you'll wait a moment, I'll get the information you need. If you'll wait a moment, I'll get the information you need. If you'll wait a moment, I'll get the information you need. How to improve your vocal communication skills. So try not to talk using the same tone all the time because it can lose the listener's interest and attention. Do not talk too rapidly to a customer. Talking very slowly indicates you do not know the answer. If the latter is the case, contact the pharmacist. People prefer a lower pitched voice. High squeaky tones can annoy the listener and they can result in the listener taking you less seriously. A loud or extremely soft voice can annoy and irritate people. Articulation is extremely important. Words are also a strong tool that can calm or escalate a situation between you and a customer or a patient. Using intimidating words, belittling a person's opinion, or leaving the customer feeling embarrassed, angry, or sad may alienate the patient and result in loss of business. So then we have just some scenarios that you can read through. How to improve your verbal skills. So reading increases your vocabulary. Take a course in communication. Several types of communication aids are available that you can use to increase your vocabulary, such as CDs, DVDs, and internet sites. Procedure 4.2 has a just a little activity on recognizing and responding to verbal communications. So optimizing your communication. The following are a few tips to optimize your communication abilities. So, number one, use open ended questions. This gets you more than a yes or no answer. It shows the patient that the conversation is not just one way and that you care about his or her perspective. Provide empathetic responses, minimize distractions. Another key area of communication in the pharmacy workplace is telephone interactions. A knowledge of proper phone etiquette is important when dealing with patients. Etiquette is an unwritten guideline or rule of behavior. Both traditional phone and cell phone guidelines are discussed. Answering the phone in a busy pharmacy is traditionally the technician's job. Technicians conduct a great deal of daily business over the phone. The manner in which they answer the phone can set the tone for the remainder of the conversation. A professional attitude and good judgment should be used at all times. With each call, the technician must decide either to direct the call to the pharmacist or to handle it himself or herself. Box 4.2 lists an example of unacceptable phone etiquette. Remember the following guidelines when interacting with patients and medical personnel over the phone. Always clearly identify the place of business, your name, and your title when you answer the phone. Carefully listen to the caller to determine the nature of the call. Determine whether the task is within your scope of practice as a technician or whether it should be forwarded to the pharmacist. If the call can be handled by the technician, make an offer of assistance and restate the purpose of the call before placing the customer on hold or ending the conversation. So, cell phone etiquette. As of May 2013, so these statistics are a little old, but these have the number of adults that have a cell phone, a smartphone, a tablet, an e-reader. So, guidelines for cell phone use in the workplace always give 100% focus to the customer in front of you. If you're on your phone, your attention is diverted. Keep cell phones out of sight. This could be in your locker, pocket, handbag, or briefcase. Keep your phone on silent or vibrate. Never text or talk on your cell phone when filling a prescription or dealing with a customer. Keep personal calls to a minimum so you do not appear unfocused to the customer or the pharmacy team. In today's workplace, pharmacy technicians must be proficient in written communication. They must be able to document information, procedures, and actions accurately and clearly. The ability to coordinate written, oral, and electronic communication is a vital to a successful pharmacy team. If the technician's writing is inaccurate or illegible, mistakes can be made and poor patient care can result. Technicians are responsible for written communication, such as memos, emails, and ordering supplies. Employees with good writing abilities come across as more capable and more credible than their coworkers who make spelling or grammatical errors. In the workplace, remember to proofread all written communications from emails to tweets to company memos. Box 4.3 lists examples of poor written communication skills. Special consideration should be given to patients who are terminally ill. Remember that they may be feeling overwhelmed. Although each person copes with his or own mortality differently, there are normal progressive steps that people experience. The 5 stages that terminally ill patients experience are as follows. So the one stage is denial. This can't be happening. Anger. It isn't fair. I don't deserve this. Bargaining. Please make me better and I promise. Depression. I will never be able to see you again. And acceptance. I can do this. Everybody does. We live in a culturally diverse society, and technicians often encounter customers who do not speak English as their first language. Technicians who speak multiple languages are in high demand and can play an important role on the pharmacy team. Approximately 36 million Americans have hearing loss. An estimated 1 in 3 cases is caused by excessive noise exposure. 1 in 5 American teens has the same degree of hearing loss found in adults 50 to 60 years old. Considering these statistics, there is a high possibility the pharmacy technician will encounter a hearing impaired patient. Therefore, it is important to be aware of any special needs the patient may have as the person approaches the pharmacy counter. Today, the pharmacy technician is an important member of the healthcare team. In the retail setting, the team may consist of the technician, the pharmacist, the pharmacy manager, counter personnel, and other store employees. In the institutional setting, the team may include technicians, pharmacists, and managers, physicians, nurses, and other departmental personnel. Effective communication is challenging in today's workplace. As discussed earlier, there can be many barriers, such as those involving language differences and hearing impairment. The first step in eliminating these barriers is to recognize that they exist. Then it is the responsibility of each team member to be knowledgeable about the techniques used to overcome these obstacles. When serving patients, technicians should give each person their undivided attention. They should provide all customers with the opportunity to ask questions. Verification of understanding is needed for optimal compliance and patient safety. And technicians should strive to really hear and understand each individual. Effective communication can increase adherence to treatment and decrease adverse effects, which ultimately leads to improved health and safer patient care.